gears to the core conversation of today on NTV Today, rheumatoid arthritis. And I believe this is something you probably have seen, maybe did not know what it's called. And we shall be informing you more about it, because those that live with this condition can tell you it is not an easy road, and definitely the infrastructure, in as far as the health infrastructure to help those living with this, needs to be improved to help them along with this. Now, before I introduce you my guests in studio, let's get to understand a little bit about rheumatoid arthritis. It's Rheumatoid Arthritis 101, and let me just touch on the fact that it is an autoimmune disease in which the body's immune system actually mistakenly starts attacking your joints. Now, rheumatoid arthritis can also affect other parts of your body, including the skin, your eyes, your lungs, your heart and blood vessels. And also doctors right now do not really know what causes this, but most often than not, this is actually said to be of genetic. Genetic component appears to be likely, but of course the environmental factors that play into this. Now, before I get into the details of it, let me okay, I guess my graphics are now ready. There we go. Rheumatoid arthritis is an autoimmune disease in which the body's immune system mistakenly attacks the joints. Now, to the next, rheumatoid arthritis can also affect other parts of your body, including the skin, your eyes, your lungs, your heart, and even your blood vessels. And doctors don't really know what causes rheumatoid arthritis, although a genetic component appears likely. And the symptoms, and maybe this is what will sound familiar to you, is that it involves joint pain, joint tenderness, swelling, redness, warmth, stiffness, fatigue, loss of appetite, and these are just some of the symptoms. Now, get this, and this is what stands out quite a bit. Women are up to 3 times more likely to develop the condition than men. Well, let's get to know more about rheumatoid arthritis. And in studio with me, of course, we have Dr. Eugene Genga, who is a rheumatologist. And of course, we have Koki, who is living with rheumatoid arthritis. Thank you for joining me this morning. Now, I'll start with you, Dr. Of course, the first question is, what's the difference between rheumatoid arthritis and, say, osteoporosis?
Okay. So, rheumatoid arthritis, like rightfully said, is an inflammatory disease. So basically, the immune system is unable to recognize the normal self versus the germs. So what happens is it attacks everything. So primarily for rheumatoid arthritis, the main focus is the joints, particularly the soft time. So the hands, the small joints to the hands and the wrist. Height presents with swelling, joint pain, fatigue, and you get a lot of morning stiffness. Versus osteoarthritis, which most people are more familiar with. Osteoarthritis is more common with the elderly. So basically, this is basically wear and tear. What the example I give to my patients is, like for a car, you have to change the shocks, you have to change the tires. Versus in a human being, the joint, the cartilage, the skin that lines the joint usually breaks down over time, and then you develop now osteoarthritis.
Okay, and while we're still clarifying on the definition of the same, there's some who would say rheumatoid arthritis is closely related, if not the same, with gout.
Not exactly. Gout is more of lifestyle. It's more common in men. The age group is about 30 going upwards, and it's more associated with the alcohol, nyama choma. There's a bit of genetics.
Symptoms?
Symptoms are now with gout is a bit different. Gout, you have migratory oligo, meaning one joint, versus rheumatoid, which is multiple joints. And usually for gout, usually the big joints like the toe, the knee, isolated today. Another day is the side. It keeps moving. Rheumatoid is constant, and it's throughout.
Okay.
Yes.
All right. Now that we're talking about the fact that it affects up to 3 times women more than it does men, Kajuju, at this point, you can let us know about your experience. When were you diagnosed with rheumatoid arthritis?
I started getting the symptoms when I was 7 years.
7?
Yeah, 7 years, which no one really knew what was happening because mostly affecting older people than it does young people.
Yes.
So no one really, because it started with the skin, and so it took me 3 years to actually find a doctor who is a specialist for rheumatoid arthritis. Yeah.
Okay, 7 years old.
Yes.
When you think about arthritis of whatever nature, because we know there are many forms of arthritis, you relate it with age. The
Yes.
older you are, the more susceptible you are.
Yes.
Explain how a 7-year-old is dealing with rheumatoid arthritis.
Okay. Usually, what I tell the patients is that at different age groups, we have different causes of arthritis. And I also give the example that even animals like dogs, cats also get arthritis. So as long as you have a joint and it's painful, tender, you have arthritis. Just that now in the younger age group, there are different causes. So usually for the younger age group, are more of the inflammatory, which are the rheumatoid arthritis. There's a special one called spondyloarthropathy, one called reactive arthritis, versus the elderly, which people are more accustomed to is now the wear and tear, where the joint breaks down, which is more common in the big joints, but like the knee, the back, the shoulder. So most people usually associate arthritis with the osteo, rather than knowing that there are other causes of arthritis. Yes.
So how would you explain maybe her causes, and maybe she can tell us this. Is rheumatoid arthritis or arthritis of any nature in your family?
Yes, my dad used to experience a little of back pain, but it wasn't anything serious because he's never been treated for arthritis or rheumatoid arthritis. So, but then now I think so it was passed down to me, which now came out more in a very different way than it did affect him.
Okay.
Yeah.
All right. So that confirms the fact that there's a genetic component that is
Yes.
actually associated with it. And how much of it then does the environmental factors feed to it?
So, okay, generally there's a 7% chance of genetic, like mother, uncle, and all that. So in terms of environment, so when you have the genetic predisposition, meaning you're at risk, so now the environment now contributes. And how it contributes? Through infections mainly, like viral infections can do that, bacterial infections can do that. Other ways which the environment can contribute, but more to lifestyle, smoking. Cigarette smoking has been associated with rheumatoid arthritis. Diet has also been associated, particularly food that have high omega-6, which would be like the fried foods, a lot of fat, when sunflower oil have been associated with rheumatoid arthritis. But what we believe is that it's not just the environment. We believe that it's multiple things coming together. So there's genetics, there's environment, there's an unknown component we don't know, and a bit of lifestyle. Yeah.
Okay, we touched on the fact that the symptoms include joint pain, joint tenderness, swelling, redness, warmth, stiffness. Kajuju, for you, what were the symptoms?
So my symptoms was my skin turned. I became very dark, and then it was dry, and then it would crack at one point. So over time, I was treated for skin disease, not knowing it was rheumatoid arthritis. And then now I started experiencing joint pains. I couldn't walk well. I couldn't. My hands, especially in the morning when I have to wake up and go to school, it was a struggle because you have to. Before my hands get moving, or it was crazy. So that is when now either like the stiffness, the swelling, that is when after now I started getting such
To a conversation on rheumatoid arthritis. And Kajuju, you were mentioning how waking up in the morning, you already wake up tired.
Yeah.
Is that as a result of the condition, or is it as a result of a medication?
It would be because of the condition. The medication, the side effects are more like maybe nausea, maybe headaches, but then it doesn't contribute so much, but because it's the joints and they're pretty much we use, every joint gets us to work.
Yes.
Yeah, so now when you start getting your body to work, you're so tired even before you begin. So it is because of the condition. Yeah.
Okay.
Yeah.
So apart from the fatigue, what else do you deal with on a massive scale compared to somebody who doesn't have the condition?
Fatigue and pain. Pain is almost something that you almost get used to living with it, because it's very it also varies on different days. There are days that you're in pain. There are days you're just okay.
And when you say pain, you're feeling pain on the joints, or what exactly? Where is the pain at?
The pain is on the joints, and having now rheumatoid arthritis affecting all the joints in your body, then that can give you an idea of how much pain, or how you have to almost adjust to having this, or rather trying to manage the pain. Because mostly what we do is manage rheumatoid arthritis.
Yes, because it's not curable.
Yeah.
Okay, now we have those pictures just to give you an idea of what kind of deformities that rheumatoid arthritis causes. Now you can see the inflammation, as Daktari had put it, on the different joints, and how it now with time, Daktari, looking at those hands, help us understand from the normal hand to now where the bone now gets displaced.
So maybe I can use this.
Yes, yes.
So like I said, with rheumatoid arthritis, it's really the location.
Yes.
Like I said, it's the wrist. We call this the PIP joint and CP joint. The ones that the farthest next to the toe, next to the nail, are rarely affected.
Yeah.
So what basically happens is that because when you have the rheumatoid arthritis, it sets off like the example uses fire. It's a fire, the switch that is on, and then now the fire consumes the joint.
Okay.
When it consumes the joint, it leads to the joint deformities.
Okay.
Primarily where here and here, which you can see for Kajuju.
Yeah.
All right.
Here and here, yes. And that over time now leads to the complications that are associated with it. Actually, the drugs that we give is not actually to cure, but to try and control that fire and put it to sleep, which we call remission.
Okay. Yes. Now, from the pictures, the deformity looks definitely a bit more different, actually totally different from what Kajuju is living with. I mean, so does...
Maybe I can help. There are different, there are very many complications with the hand. So there's one we call the ulnar deviation, where it goes sideways.
Okay.
That affects the wrist. We have one that affects here, so it becomes like a claw hand, which
so it becomes, yes.
There's one we call swan neck. It looks like a swan's neck. Literally like a swan's neck. In the very, very advanced, it actually looks like this.
Okay.
Yeah, where it's short and actually downward, it actually come down like this. In the very, very advanced.
Okay, and just looking at the pictures, you mentioned how the wrist will make the hand move to one side, but also the fingers look like they also...
They move that side. Because actually there's something called tendons. There's some muscles that go inside the hand, and these tendons are now that help to move the hand up and down. So the tendons go through the wrist.
Okay.
So if the wrist is damaged, it forces the tendons to do what? Go one direction. That's actually the science behind it.
Okay. Explain the, I think we'd call them nodules on the, they're the bumps nodules on the joints. What are those?
So the nodules, because rheumatoid arthritis not only affects the joint, can affect the tendons also. So it affects the tendons, you get like a local collection. It becomes bigger than normal. A local connection. It can actually affect the hands, sometimes even here, at the elbow, here, here, around the eye, even around the neck. And like why I think for her, the one for the brain most likely was that rheumatoid nodule. And even can go to the lung also.
All right. And speaking of which, earlier we had mentioned that, I mean, rheumatoid arthritis can affect other parts of your body apart from your joints. And you mentioned, Kajuju, when you were 7 or younger, your skin had an issue. What exactly was it? You said you turned dark.
Yeah. Okay, so I think, so how you explain it is, you know how you get a sunburn? So your skin turns dark and you become, it's so dry.
Yeah.
So that's the same thing that happened, but now my skin from my head to my toes. So the skin was so dark and then it became so dry that it doesn't matter what you use on it, that it would still crack. So walking then was a problem because you know how when you walk and you exert pressure on your feet, then it cracks even more. So walking would be, you know, so you're walking and then but still your feet are bleeding. So it wasn't So that is what happened before now, as it progressed to now starting maybe with the joints and then the eyes and then now the hips and yeah.
And Dr. Ari, is this something that occurs? Because I mean, why the skin first?
There's no particular reason as to why the skin first, because the way it presents is very varied.
One person to the other.
Because I've seen patients who come and tell you after delivery, I got a joint pain. The others come with like water in the lungs, and with the test, it turns out to be rheumatoid arthritis. The others who come with kidney problem, it's rheumatoid arthritis. So the presentation is very, very varied. For the dryness, what it does, it affects the glands that supply water to the skin. Also can affect the eyes, you get dryness of the eyes, even dryness of the mouth. Yes, these are some of the symptoms of rheumatoid arthritis.
Okay, so I'm hearing it can attack other parts of your body because it's an autoimmune condition, and it sounds very similar to lupus.
Yes, that is very, very true. In fact, if you look at the age group, gender is ladies and everything, but what differentiates lupus from rheumatoid is that rheumatoid is an erosive disease, meaning it burns the joint. Lupus doesn't. So whenever we are torn between is it rheumatoid or lupus, a simple X-ray of the hands can tell us. But also lupus tends to have other features. You get like the rash on the cheek. You can get muscle issues, muscle weakness and all that. So it's a bit different. So for rheumatoid, it's mainly the joints, but usually it burns the joint. That is the main distinguishing factor.
Okay, Kajuju, so you're young, you're dealing with this condition. Clearly sounds really painful because if your body's cracking at will, and your parents are wondering at this point, what is their child suffering from?
Yes, they were, and well, very confused because it wasn't anything that you'd wake up and imagine maybe someone has a headache. It's very different because the skin has turned, so you start looking for what could be the problem. But now so when we go to the doctors, everyone is treating the skin rash and how it looks like, but then they're not going deeper into what else could it be. So that is why it took me 3 years before I got
a diagnosis. Obviously. Okay.
Because when the joint pains, then the doctor tells you, oh, that could be, it's just maybe arthritis, or maybe it's because of the, it's cold. So all you need to do is maybe work out and, physio, and you'll be better. But then it never got better because it became worse. The pain when you're doing the exercises is worse, because you have to, now the joints that you're feeling the pain, and you have to work them out. So
now it's interesting, Kajuju, if somebody wasn't paying attention to your hands, you look normal. You're fine. You're like the next person. Which now brings to the fore the fact that you probably faced stigma growing up. I mean, if you had to deal with this from 7 years old, I can only imagine how your journey has been. And I'd like to hear of the same right after this break. Remember our conversation today, rheumatoid arthritis, Kajuju living with rheumatoid arthritis, and Dr. Eugene Genga, who is a rheumatologist, giving us more insight on this autoimmune disease. Stay with us. Dr. Let's kick off with this question here where somebody is asking if you actually are if rheumatoid arthritis is Carolina. She's saying if rheumatoid arthritis is realized early, diagnosed early, and management is initiated, does it progress?
Actually, they've done research in the West, and the current treatment is that we're going for early diagnosis. In the West, they have something called an early arthritis clinic. So you're sent quickly to see the rheumatologist, treatment is started, and actually, we have data that says within 7-8 months, you can actually get a functional cure, in quotes. So it's actually very possible.
Okay. Now, in her case, seeing that, I mean, at 7 years old, 3 years later, she was now given a proper diagnosis. Why the progression?
So the thing is, it's varied in the presentation, but what we've come now, we've done some research, some paper we're going to publish, but a lot of our patients take more than 6-7 months. Actually, the showed that about 60% of the patients took more than 6 months before they actually saw a rheumatologist. And those are some of the challenges we're having, because if you're not able to get this disease early, because of the problem. So the example I usually give is like an iceberg. An iceberg is not the top what you see. It's actually at the bottom that is big. So the top may looks okay, but underneath the surface, it's just hell. It's burning. And that's the problem now with rheumatoid arthritis. So the longer you take before the diagnosis, the outcome usually is not as good as someone who came early and started treatment early.
Okay. So Kajuju, before we went to break earlier on, we were talking about the stigma that comes, with rheumatoid arthritis. We were talking about deformity of your fingers, other parts of your body. And for you, having faced it so young in life, and many people, including your parents, not understanding what's going on, paint a picture of what you had to deal with people who are oblivious of rheumatoid arthritis.
Wow. Having gotten it so early and not so first thing is people didn't know what was happening, and then so there are people who kept staring, and of course there are people who would start coming up with theories of what it could be. And being so young, so you're trying to also gather what could it be, because you don't know what is happening. Everyone in your family has never had anything close to that, so it wasn't easy, because not at least knowing something tangible that you can also put back out there. This is what it is. It's easier to deal with it than what is brought to you, or for you to be able to now try and translate it to, okay, this is not what you think, this is what it is. So I had to deal with that for many years, and even now people do not completely get it sometimes, especially when you're maybe shaking hands or something. So someone will just stop midway to just stare at your hands, at my hands, and then they do not ask anything. So there's just always that awkwardness. Yes. So, but it's over time, because people react differently to different things. So you have to understand, for you to guard yourself from any from feeling very different, I always strive to be, I am the same as everyone, as every kid. So I'd try and do the games that they were doing, in as much as you're straining, because you want to be like all of them. So but I think that was almost an important thing to learn so early, because then you're able to stand up for yourself. And then because the medication was very expensive, and and also the consultation for the doctors, insurances don't cover for most of the medication. So you have to work extra hard to get the money. So at one point I felt so bad that my parents would take me to the hospital all the time. So at age 12, I'd come all the way from Meru to see a doctor in Nairobi and back. So I had to start learning. I had to grow up faster than anyone else had to, because some of the things you have to learn how to do them yourselves, but there are also things now you couldn't do yourself, like putting on my shoes, wearing my socks, bending. You had to do activity that doesn't allow so much flexing and such things,
and doesn't flare up the joints.
Because if they do, then tomorrow will be a more difficult day than it was today. But at the end of the day, I think I just had to push myself, because I had to remind myself just not to be defined by what I am going through. So went to design school, where you're supposed to do quite a lot of things. So had to so at that time no one looks at what are you going through, but sometimes it's also hard to explain to like teachers, and I am behind because like I had to go back to, you know, go see a doctor, whatnot. Because I even remember my graduation I never attended because I was in hospital then. So after school, now you go now to start working, which becomes even harder because you cannot keep giving the same, you know, stories every now and then. Someone thinks, no, no, no. You cannot be, today you came in sick.
Yes.
You took a day off, went to the hospital, to, you know, so tomorrow becomes a different thing. So you might have gone to the hospital because of maybe a headache, but then tomorrow it becomes your now the effect of the medication. So you start having gastro pain, or, you know, it's just, so it's very confusing to keep telling people. So I've had to like move jobs, and then at one point, you know, I was like, you know what, okay, let me just do this on my own when I know what I'm able to do, when I'm able to do it. So that is when I started my own company. So yeah, it's
fashion and design?
No.
Oh boy.
It's an interior design company. It's actually, we offer, it's called DIBA. We offer architectural and interior design drawings, which I insist to people, because with people still not knowing a lot about all these diseases that come with of age, when, you know, as you grow older, then you start getting such say rheumatoid arthritis or just general arthritis, you're able to advise people, having lived with it.
Yes.
I'm able to advise people better on, you might not have it now, but you might have it, you know, it might come later. So this is how it would be best to, you know, design your house and whatnot. So
all right.
Yeah.
Okay.
Yeah.
Excellent. Now, Dr. that's very encouraging to hear that she's accepted her situation and actually lives with it and passes on the information to other people. The same reason we're having this conversation, because it's with us. I'm sure people are looking at the pictures and saying, oh, wow, I have seen this. My family member lives with this. I live with it. But there's so many questions that come with it. Now, when we come back, Dr. we'll talk more about your perspective in as far as stigma and how it has been a barrier to actually even getting proper treatment for the same. Let's put a bow to this conversation on rheumatoid arthritis. Definitely a lot of information coming out of it, and I keep saying, when you put a face behind a condition, we now start relating to it, you know, and give it the attention it deserves. Now, Dr. the treatment of rheumatoid arthritis is very expensive. She's touched on the fact that this is one of the impediments for most people even getting the right treatment or even diagnosis of the same. What ideally should be in place to ensure that we help those living with this condition?
So for treatment, I think the first thing is diagnosis. I think raising awareness is one thing which we need to do. And awareness not just amongst the healthcare providers, but also the people generally. Like this forum is an excellent forum. Just give some public education. Secondly, there's a concept where practice, they used to have something called an early arthritis clinic. So the earlier, any person with joint pain was sent there, evaluated by a doctor, and then from there they can tell you, do you need to see a rheumatologist? You can just go home. So I think that's something which you need to do. And speaking of doctors, we have very few rheumatologists. I think the ratio should be 1 to 100,000. Currently, I think we're less than 10. And
in the country?
In the country. And most is based in Nairobi, which is unfortunate. I think Mombasa has one, Eldoret has one. Kisumu, somebody is going to train, but most basically are in Nairobi. So it means somebody in Mandera or Wajir has to come all the way here. And in between, I've seen a patient who for 2 years was treated for typhoid and malaria before she had enough to come to Nairobi and then to rheumatoid arthritis. And that is the story that we have. So I think if we're able to raise awareness, it'll be something good. At least now I'm seeing the many medical schools coming up. I hope in the curriculum for the doctors that they have something on rheumatology, because I think if we're able to teach the undergraduates, I think something would be something to follow going forward.
Okay, Dr. Are you saying that we probably have fewer specialists, maybe because they're not interested or they do not even know the importance of this specialty?
I think it's more do not know, because I'll give my experience as an undergraduate student. When we were taught rheumatology, the first reaction was, these are those Mzungu diseases that you see one in a blue moon. That is the perception that we have, which is not the case. And even when you go outside, when you go for conferences outside, when you present data on this disease in Africa, they even get surprised and say, are you sure you got this diagnosis? And show them the pictures. It's something which is very, very fascinating for them. So I think going forward, I think more needs to be done in terms of, I think we need to publish more and get more information out. And a lot of stuff has been done on rheumatoid arthritis, especially in Kenya. In Kenyatta Hospital, a lot of papers are there. From, like, take for example, like people with rheumatoid arthritis in Kenya at a high risk for developing diabetes, hypertension. People with rheumatoid arthritis have eye problems. That has been documented in Kenyatta. We've also found that the control is not adequate. We're hoping now with the new guidelines, which I've given you, I'm hoping the new guidelines will be able to help better control. Actually, Kenyatta, the one study that looked at the control showed that about 2% of the patients in the clinic actually had adequate control. The rest had some sort of active disease, which is unfortunate, despite the fact that majority are on the proper treatment.
Okay, for you, Kajuju, you mentioned that you had to travel all the way to from Meru to Nairobi to seek treatment. I mean, we're talking about health being a devolved factor. I mean, why shouldn't we, or what should be done in the counties to give more relief to those that are living with this condition?
I think we need to, like he said, we need to also create awareness, because there are different. I think the more cold the area, the more prone the people are, get the rheumatoid arthritis or the joint pains and whatnot. And Meru being a very cold place, then the majority of the people right there, right now, there's shown a very high increase of people who are suffering from rheumatoid arthritis. But most of the time they're treated for different things, because maybe the health providers there don't have enough knowledge of, and if there is one, then it's one who is supposed to cater to many people. So if we have a system that helps to arrest these cases very early, then we're even able to reduce the number of people who are living with it. If it's arrested early, then it can be managed faster or even better. But now people live with it for so long because of not getting the proper medication or seeing the right doctors, because of the mixed symptoms. Sometimes you have symptoms that are, someone cannot think there is anything linked to rheumatoid arthritis unless you start mentioning of, the joints and whatnot. But at that time, the joints have already deteriorated. So if we have a system or a way to start identifying this illness very early, then from different places there needs to be at least a doctor who understands it, so that someone doesn't get all the way, to now the stage 4.
Okay. All right. I am told that we have Isabel from Roiro who has a question for Dr. Isabel, what's your question or comment?
I want to ask the doctor if they know about the infrared heat. Far infrared heat.
Infrared heat?
Yes.
In relation to?
To rheumatoid arthritis.
Treatment of the same?
Yes.
Okay. All right, Daktari, what's that about?
To be honest, I'm not that familiar with infrared heat. Usually for treatment for rheumatoid arthritis, there are many forms of treatment. We have the traditional, we call them disease-modifying agents, the methotrexate, the flonamide, salazopyrin.
Now, all these are what?
Tablets? Just tablets.
Okay.
Sorry, the tablets.
Yes.
Sorry.
You're dealing with laymen.
Sorry. So basically, they're just tablets. And they've been used for the last 40, 50 years, and they work. They work. But now, with the advance of technology, the newer, we have some, we call them designer drugs that work targeting specific pathways in the science that involves rheumatoid arthritis. Those are those that are a bit more expensive. Can go up to 300, 400,000. So in terms of infrared, to be honest, I have not come across anything like that. And I think there's nothing that infrared does, to be honest, in terms of treatment of rheumatoid arthritis. Because even the science, if you try and even think about how it would possibly work, it doesn't.
It doesn't make sense to you right now.
Yes, yeah.
Okay, probably something you should follow up and understand where that is coming from,
Yes.
yeah? Now, Kajuju, you mentioned the fact that some insurance companies or just insurance companies do not cover the cost of treatment. What is the reasoning behind it? What do they say?
So, because when you have, say, rheumatoid arthritis, then it keeps changing to, you know, today it's affecting your joint, tomorrow it might be the kidneys. So there's this link to it that now keeps falling back to rheumatoid arthritis. So that becomes a high risk. You know,
become a high risk patient.
Yeah, because now they have to keep, you know, and then the treatment itself is very expensive. So trying to, so having this patient who, you know, who is linked to so many, or who is open to getting so many complications, then it becomes a problem. So they wouldn't want to. And if they do cover you, then probably the next, when you're renewing your cover, you probably have to pay, they have to revise your policy, and then maybe you have to pay a little bit more, but for the same services that you're getting. So it becomes, it's very disappointing that you have to be treated like you're doing this to, you know, so.
Okay, now Dr. before you give me your perception on that, John from Kitale now joins us with a question or comment for Dr.
Thanks NTV for the program. Now I have a question for Dr. And my question is this disease inherited? I mean, can it be inherited from parents, brothers and sisters?
Yeah.
Okay, John, this one we have already answered because Kajuju says she actually got it from her family lineage, and Dr. confirmed the same. There is a genetic link.
My TV late, probably I never had that part of, you know, explanation. Thank you.
All right, asante sana for your call, and of course keep them coming through. Remember, on Twitter we are also seeing your questions, and we shall be addressing them. Now, Dr. Harry, when I listen to her, I think lupus also falls in the same basket where insurance companies would prefer not to go there because of how it changes the dynamics of a condition. It is, to a very large extent, very discriminatory, right?
It is. I think it is because they don't choose. You don't choose to be sick. Yeah, and that's what most of these insurance companies don't get. I know for them, they're looking at their markups, how much profit they can make and everything, but the patients genuinely need the medicine. I think the major issue they have with this disease is the cost, because the cost of seeing the doctor, the cost for the medicine, you can spend, some people tell me I spend up to 40,000 shillings a month, even 50,000 shillings a month.
Wow.
And those are the cheaper ones. We have some drugs that you take. There's one drug you inject, you get like it's around 95,000 shillings a month. There's another is about 200,000 shillings every 2 months. Another is about 400,000 every 6 months. Wow. So you can see the costs are very astronomical. And then also on top of that, you are at risk, like what Karana said about the kidney issues and all that. So there are a lot of things going on. So for most insurance companies, they tend to shy away. So I think this is an opportunity where NHIF can come on board. Because I'll give, for example, there's a drug called rituximab and even methotrexate. We use them in rheumatoid arthritis, but they also fall under cancer medicines. Yes. But something like rituximab, which is a 400,000 shillings, if I went to the cancer, take for example like a blood cancer like lymphoma, the government will sort me out through NHIF. If I come with rheumatoid arthritis and ask for the same drug, I'll be told no, it's not covered.
And yet,
it's the same drug.
Rheumatoid arthritis can actually cause a lymphoma.
Not exactly. The medicine, the way it's been designed, the medicine can work in both ways. Yes, yes. I don't want people saying that it can cause. Actually, they've done research. And
it's not a complication?
No.
So there's no connection whatsoever?
Yes, they've shown, yes. So the thing is that it can be used like a drug in this, like for methotrexate, lower doses is for rheumatoid, higher doses are for cancer. Yes. And if you go for the cancer model, you'll get it.
Okay.
If you have rheumatoid, they'll not give you.
All right.
Yeah.
Now, before we wrap up this conversation, I need you to kind of bust some myths or some of those ideas around rheumatoid arthritis. So,
Okay.
what should patients watch out for or stay away from to avoid flare-ups? Is coffee one of those?
Coffee, not usually for dynamic diet. From the American Diet Association, they've shown that for rheumatoid arthritis or in general arthritis, you want to avoid food that have omega-6. That's the fried foods, the chips and everything, together with alcohol, cigarette smoking, and avoid gaining weight.
Red meat?
Red meat is okay in the right quantity. The only problem, patients come and tell you, I take once a week, take 10 kilos once a week.
Yeah,
and I tell you it's once a week.
Yeah.
But red meat is fine.
Okay.
And then also other things, other diets that help are calcium and vitamin D. And that's gotten in meat, poultry products, the sukuma wiki. That one helps there, because usually with the rheumatoid arthritis, it eats at your bones and your calcium goes low. So actually when you get towards 40, 50, you're at an increasing for developing osteoporosis now. Yes.
What's the connection between rheumatoid arthritis and milk, dairy products? Does it aggravate?
There's no really hard evidence that it aggravates. I think the best answer would be that the dairy products have a lot of calcium and vitamin D, which is good generally for rheumatoid arthritis patients. Yeah.
Okay, now it is said turmeric or even ginger actually help with the inflammation and the stiffness. True or false?
It's true, but it's a but.
Yes.
Because I'm sure even Karana has met this girl who tell you just take the turmeric and you'll be fine.
Oh, yeah.
It contributes to a small percentage. You have to combine with the medicine. So and the patient, I think that our patients tend to feel safer when they think it's a herbal stuff like turmeric, rather than giving that drug. So it should be used complementary, not in isolation. So apart from that, things with vitamin C, vitamin E, antioxidants. So the fruits, bananas, oranges.
Speaking of which, avocados I hear are really good for you.
That's fine.
Okay. All right. We know we have a soft spot for the avocados. Yeah. Now, Kajuju, what has worked for you? Because, of course, with to each their own.
Yeah.
So the turmeric and the ginger, did that work? Or what have you found that you've adjusted in your diet that helped along with containing the symptoms?
I try to, I try and eat as healthy as I can. That means spinach, things, have fruits, turmeric, ginger, they help to some extent, but not completely. So that is why you, like he said, you have to use them as a complementary. And what else? Yeah, those are the two major. Yeah. Yeah, that just relieves the pain and reduces the inflammation, and then that keeps you going.
Okay.
Yeah.
Now, as we say goodbye, Kajuju, what would you like to put out there for people to understand about those living with this condition and the kind of support they need?
To the people who are living with a condition, how would I say it? You don't have to feel very different from the rest of the people just because of the things that you're going through. But it's also important that you keep taking your medication, like the doctor says. You have to eat healthy. You have to follow the guidelines of the doctors, and then that way you have a better, you manage it better than you would if you ignore such things. Herbal medication, just
the doctor is shaking his head.
I wouldn't say it doesn't. It's a supplement. It's added on top of what you're taking from the doctors. But do not put your medicine aside and decide to go herbal, and it pretty much might not work. Also for the support, I love my parents, people who are close to me. They've always pushed me to be better, to do better, and by that I'm pushed to inspire other people, to make them know that there are so many people out here living with it. We are not, we don't have to, feel like this is, I'm suffering alone. There are people out here who have had it worse. Doesn't mean the pain is, any different, but that should encourage you not to give up, to, keep pushing on, push to your dreams, do the best that you can with the time that you have, because at the end of the day, you need to leave a mark in your life and inspire, lift other people, talk about it, don't suffer in silence. That is a quote that is usually in Dr. Oyo's clinic.
Yes, do not suffer in silence.
Do not suffer in silence.
Okay.
Speak about it. It makes it easier to know that other people are dealing with the condition. But also I'd really urge, the health sector to start to bring in systems that accommodate these people, because now that is genetic. I might pass it on to my children, and I wouldn't want them to go through the same thing, that I have gone through. Say, I want them to have an easier time going through it by medication, by, having proper guidelines, having proper knowledge of what it is.
Information is power.
Information is power.
Kanana Kajuju, thank you so much for your time. She's living with rheumatoid arthritis, and Dr. Eugene Ganga, who is a rheumatologist. Thank you for giving us so much insight into this. And remember, your questions on Twitter and, of course, on SMS, they can also be addressed by Dr. So keep them coming through. And thank you for your company on NTV today. My name is Gladys Gash.